welcome back to another episode of the Association Spotlight Series. We got a little sub-series kicking off this fall, kind of focusing on our CCBHC model that's coming up here as West Virginia has become a demonstration state. Going with a little bit of the series will be called Care That Connects, CCBHCs in West Virginia. So today, of course, we thought no better to start it off with our CEO, Brad Story. Brad, thanks for joining us here, just to kind of educate the folks, let them know what's going on here. We're in middle of August right now, kind of ramping up everything and getting the CCBHC stuff kicked off, and it's pretty exciting stuff. So thanks for joining us, kind of talk about it a little bit, let everybody know.
Well, thanks for having me, Lake.
Yeah,
I appreciate it.
Yeah, big long walk from your office, I know. Hope you're good.
Out of breath.
Yeah, oh yeah. So so we could just kind of let everyone know what's going on with CCBHCs and West Virginia, the exciting parts of it, just kind of the basics. Let everybody know. It's a big long abbreviation there. Everyone maybe is not sure what that entails, what that means for West Virginia and the state of behavioral health care and what that means for us.
Yeah, sure. So CCBHC stands for Certified Community Behavioral Health Clinics, and it is a federal model throughout the United States. I think currently there's probably almost 600 CCBHCs across the state. Yeah. And basically it's a one-stop shop for behavioral health centers in West Virginia. So, your clients come and they are surrounded with wraparound services that they need from a behavioral health perspective.
Right. Yeah, so it kind of covers, just wraparound services there.
Yeah, it's a one-stop shop. You come in and you may need, some counseling, but while you're there, they're going to make sure you get your primary care screening. They're going to make sure that you get connected to employment, whatever the need may be, they can take care of it there to CCBHC.
Sure, which is especially useful in a state with like West Virginia, like us, where we are so rural, and a lot of times people have to drive a long ways to get a lot of different cares. Well, this kind of really consolidates a lot of this stuff and is helpful in all kind of facets, right?
Yeah, so you think of integrated healthcare, which is the model most places are going to throughout all healthcare. You look at FQHCs, they do it on the physical health side. CCBHCs, they primarily do it for behavioral health needs. Yep. And one thing that is great about the model and why it was created, they realized throughout the country that the population we serve are very difficult to pin down. Mm-hmm. So you have to wrap around all the services you can within while they're in front of you.
Right.
And, the model was based off of, how can we lighten the load in the ERs?
Yep.
How do we prevent hospitalizations? How can we divert from jails to treatment? Mm-hmm. And they come up with this model to take care of all those things. And we've seen, a tremendous push throughout the country, a bipartisan push.
Yep. Democrats
and Republicans both have pushed this since 2017 to be the standard of care for behavioral health services.
Yeah, it's been a long time coming, and West Virginia was selected as a demonstration state, which is a huge deal. What we were all excited about. A lot of people worked so hard for so long to make this happen, and now it's become a reality.
Yeah, so it's super exciting because what comes with being a demo state is a 90-10 match.
Okay.
So every dollar you bring in to West Virginia or spend, you're going to have a 90 match for the federal level, which is huge because you don't see that type of match in any type of healthcare throughout any type of service line. So that will be able to help help West Virginia out financially and ensure that services are paid for and good quality services. And that's one good thing about the service too is they are required to provide 9 core services. CCBHCs are, and they are required to perform and show what kind of outcomes they truly bring and the benefit of the model.
Sure.
They have to report those to the feds in order to continue being a demo state in a CCBHC.
Yeah, so it's great, and all these conferences we go to, all the folks we meet from other states that are have been in the CCBHC model. I mean, it just seems like nothing but a home run from what we can tell for the most part. And the early numbers we've seen outcomes have been good.
They have. I think we got the 2026 impact report from the National Council, and there's tons of good information in there. But what stood out to me the most was, I think 76% of the participants in CCBHC have, been employed or actively seeking employment, learning a trade, learning skills, whatever it may take. but 76% of the members in the CCBHC program are actively employed or actively trying to be employed somewhere, which is
That's
in West
huge.
Virginia. It's a big missing piece of what we're doing here in the state, because we have the lowest workforce participation rate in the country.
Yep, that's huge. So it's
Mhm.
really, you're knocking out a lot of great things with
Yeah.
this model. It covers a lot more than people may know. I mean, it really does. We can zoom in a little bit and kind of, if you want to talk a little bit about how actually got West Virginia. West Virginia became a demo state in terms of our state level legislatively, and
Mhm.
kind of the efforts there. What that looked like.
Yeah, so I believe it was in 2017 the federal legislation passed to codify CCBHCs in the Medicaid program. And then, year after year, they passed some kind of legislation to strengthen the model. In 2022, they passed federal legislation that basically allowed 10 states every 2 years to become a demo state.
Mm-hmm.
And the same year, West Virginia codified CCBHC's existence in the West Virginia Medicaid program. So
Yep.
they passed legislation with the help of the association and the state partners to basically, if we weren't chosen to be a demo state, that we would do a state planning amendment
Mm-hmm.
to ensure that the Medicaid pays for the services in West Virginia. So we did that.
Yep.
Then 2 years later, in 2024, we applied to be a demo state. We didn't get that. But in 2026, we quickly learned that we were one of the 10 states chosen.
Yeah, no, it's great. It is. And state plan amendment, again, we have lots of acronyms that fly around here. So also known as a SPA. If you
Yep.
hear the word SPA, that's a state plan amendment there as well. It's a lot of acronyms flying around all the time.
All the fun stuff in Medicaid.
Yeah, of course,
Yeah.
right? It's a big book. So yeah, another part too, you kind of touched on a little bit earlier, but just a great thing from the CCBHC model of taking the burden off of overpacked ERs.
Mm-hmm.
Hospitals are already running so thin and understaffed and just overloaded, as well as law enforcement. With our law enforcement, we know are on board with this, and overpacking jails and holding cells and things like that. Right? This is a big benefit for those factors.
Yeah, this model is built around that. I
Yeah.
mean, so our CCBHCs in West Virginia, which we have 6 currently right now in West Virginia, and they all have adult mobile crisis, children mobile crisis stabilization units. Those all are services to help divert folks from going to the hospital, being arrested.
Yep.
Diverting them to treatment and ensuring that they get the services they need in the community where they live.
Yeah, that's great. And you said our 6. If you want to talk about maybe the 6 CCBHCs in the state and kind of where they are and what they cover, kind of have it surrounded, kind of have it throughout the state, each region.
Yeah. So we have 6 CCBHCs currently in West Virginia, and I'll start with one in Parkersburg, which is Wood County. I think Westbrook Health Services, they service a catchment area of, I want to say, 8 counties. Then you have Valley Healthcare. They North Central.
Yep.
Yeah, I think he has 5 or 6 counties that he serves right now. Then you have Southern Highlands in Princeton.
Yep.
I think she serves 3 or 4 counties in the southern part of the state. Seneca Health Services.
Yep.
They are in Summersville and Greenbrier County, and I think they have 4 or 5 counties in their catchment area.
Yep.
And then you have Prestera Health Services. I think they service 8 or 10 counties. They're pretty large.
Yep.
And then we have FMRS.
And FMRS.
Sorry,
exactly, southern
FMRS.
part
Yeah.
of the state.
So yeah, they're in Raleigh County, and they cover Summers, Raleigh, and Fayette County. Maybe one more, but they're strategically placed. They're regular comprehensive mental health centers prior to becoming a CCBHC, so they're codified in code to exist to cover all 55 counties throughout the state as comprehensive mental health centers. But they were all licensed as CCBHCs, and the first 6 CCBHCs in the state, and they're doing wonderful work.
Oh yeah. So it's a really good representation. I mean, it's kind of covering the whole state at the moment, and it's we're really excited to see it grow, and we're excited, and it's going to be a good fall and leading up to this, and it really got some good momentum going.
Yep. So right now we have a good part of West Virginia covered with the 6 CCBHCs. Still have some areas that needs some attention, but
Sure.
The model is something that we're super excited about. It's new to West Virginia in the last several years. So anytime you get something new, you have a lot of questions.
Of course.
And I think that I'm glad to hear that you are doing this podcast and concentrating on this, because we want the listeners and viewers to understand that, like, this is truly the way the country is moving for behavioral health services.
Right. Yeah, it's a great thing. And we'll stay tuned, check our social media, our Facebook pages and things. We're going to continue the educational tour here about CCBHC with infographics, putting in a lot of these things in layman's terms, because it is a lot. It can be a little bit complex and confusing for everybody. But it's a great thing, and we're really excited about it. So stay tuned. The series will continue to roll on. And Brad, thanks for joining us to kind of kick things off and break it down a little bit for everybody.
Yeah, no, yeah. I appreciate it. And as you said, this is a complicated service line, and there's a lot of acronyms. And, I'm looking forward to hearing from the CCBHCs directly and talk about how they're changing their communities and changing the way behavioral health services are provided in West Virginia.
Yeah, and we're going to feature a lot of our CCBHCs as well down the road a little bit. We can get more into who will get more into the weeds about it, some testimonials, things like that. So stay tuned. We're really excited about it. Should be a good fall. So thank you, everybody, and thank Brad for joining us today on the first one.
Thank you.
All right.
Appreciate it.